Hey, hi, I'm Mel. I'm a nurse and I run a ward, and I'm just going to tell you about the normal structure of a nurse's day. Typically one of my nurses would come on duty, and we have a solid structure where all of the nurses know exactly what they need to do. They'll come on shift, we'll have handover, so the night nurses will hand over to the day nurses as to what type of night the patients have had. And then we'll start the shift and we'll give the patients their breakfasts, we'll help them with washes, we'll get them up and ready for the day, ready for their treatments, ready for their physio, ready for their OT. And in between that and the lunchtime, we'd probably be doing doctor's ward rounds. So a nurse would have to attend a ward round with the doctor so that we can all make a plan together. And then about lunchtime, we will give out the medications, and we would then get ready for our protected meal times. So we assist the patients to sit up, clear their area, and then during protected meal times, the nurses give out the lunches to all the patients. If the patients need assistance, then the nurses give it. And during that time, no one is allowed to see the patient. That's protected time. Then after lunchtime, we have patients' rest period. So we put all the patients back to bed who need to go back to bed, so we hoist them back if they're sitting in wheelchairs, etc. And then we let them have a rest for an hour and try to keep doctors and medical students and everyone away from them so they can actually have a rest. In the afternoon, they may have more treatment. We would write our nursing notes continually as the day goes along. And then by about 5 o'clock, we're ready for the drug round again, and they'll have their drugs. And then by about 6 o'clock, we'll do another protected meal time for their supper. And then after their supper, we would get them ready for bed, get anything that they need done. And then there's another medication round when the night staff come on after they've handed over at 8 o'clock. So there's another handover for about half an hour, explaining what happened that day, any patient needs that are new, any new developments during the day, and then there'll be another drug round right before bedtime.
Okay. So Mel, what are some of the decisions that your nurses might be taking in a day?
If a patient suddenly deteriorates, a nurse has to make a decision what they're going to do about it. You know, who are they going to contact? Is it important, this deterioration, or is it something that the patient's experienced before? So the nurse has to make the judgment call. If they've found an observation that's not similar to the observations that the patient's been having previously, you know, is it significant? So they have to be thinking on their feet, you know, do I contact a doctor? Do I contact whoever they may need to contact? So they think about that. Other decisions would be perhaps in the multidisciplinary meeting we have with the OT, physio, discharge team and doctors. The nurse has to go and sit in, and we all make a decision together as to the needs of the patient and their discharge planning. And the nursing part of that is very important because their team need to know if they have any particular nursing needs that they might require assistance upon discharge.
Great. And what kind of person would you look for ideally if you were recruiting for members in your team? Someone
very keen, someone that shows initiative, a very good communicator. That's very important. Someone that's incredibly hardworking, I would hope, and someone that can show that they can think on their feet and they don't need to be constantly monitored, that they can just get on with the job.